Millions of lives are devastated.
Hundreds of homes are destroyed.
Local and global economy has drastically collapsed.
Humanity around the world has lost hope for a brighter future. Coronavirus disease 2019 pandemic, when will it end?
For decades, the medical technology profession remained unseen and unnoticed. Its significance has been silenced as not everyone knows about it.
Now, it is so evident that this is one of the leading profession across the globe due to the need to aid in the diagnosis of COVID-19. Ladies and gentlemen, are you ready to explore the world of medical technology? Mga katusok, sit back, relax, and enjoy the show. Good morning.
I am Karen Vidumangay,
And I am Marga Prada, your moderators for today. And welcome to the Eagle Squad.
Culture, service, excellence. Yan ang ating pag-uusapan sa bago nating tututukan dito sa pugad ng mga agila. Handa ka na bang makilala ang mga nagbigay ng kulay at tagumpay sa iba't ibang profesyong iyong inasam? Handa ka na bang malaman ang mga sikreto ng isang matagumpay na agila? At handa ka na bang harapin ang iyong future profession? Samahan nyo kami tuwing Martes at Sabado, Linggo-linggo at unti-unti nating alamin at kilalanin ang pugad ng agila na nagbibigay tatak at tagumpay hindi lang dito sa ating bansa, kundi sa buong mundo. Humanda na sa mga pasabog ng bawat departamento at mga agilang nasa iba't ibang panig ng mundo. Ihanda ang mga sarili at sabay-sabay nating isigaw ang tatak ng isang agila. Today, the Philippines. Tomorrow, the world. This is the Eagle Squad.
Good morning, mighty Eagles.
We are now having our next episode of Eagles Squad Show. So let's check our viewers.
Shout out naman po tayo dyan, okay? So Sir Kai first. During your younger years, what was your impression and expectations about the medical technology course?
Mamarga, actually before I enrolled to this course po, actually I really wanted to become a doctor. And then sinasabi talaga nila na this medical technology course is the best pre-med course talaga. So that's the reason, that's the very reason on why I did choose MedTech. So how about you, mom? Back then, what was your expectation or impression about this course?
Well, actually, I really wanted to take this course kasi nga, ang gaganda nila, ang gugwapo nila, di ba? Like, the sacred white uniform of Sir NJ today. Like that. I really wanted to become like him before. That was my impression. But during those years na, the succeeding years, it was really a tough journey. It was a tough experience kasi nga, tagakuha ka ng dugo, tagakuha ka ng ihi, even phlegm, no?
Yes,
We're
ma'am.
processing that, no? So,
to verify these impressions and expectations, may we call on now our first guest.
for the first speaker, may we call on the ever-competent and effervescent program coordinator, a registered medical technologist.
As the community in general, or the people comprising the community in general, for the success and the triumph we would be having in battling this COVID-19. So I hope all of you or all of us should have been doing well amidst this pandemic. Magandang umaga po sa atin.
Thank you, Sir NJ. The first question is, what is all about the course? Bachelor of Science in Medical Technology or Bachelor of Medical Laboratory Science? And of course, why this profession is really a need for today?
Thank you so much for that. No? But before I would give my insight about that, I would like to focus on what I mentioned a while ago. While we are at the era where the healthcare setting is being highlighted or is being modulated, we would always come to hear the roles of the doctors, the roles of the midwives, and even the nurses in particular, that are being highlighted amidst this crisis that we have. And oftentimes, or should I say most of the time, even pre-pandemic, we forget that there are other individuals who are involved in the healthcare setting. Nandito yung mga radiologic technologies, and also we have here the medical technologists or also medical laboratory scientists and some other individuals involved in the healthcare setting. But medical laboratory science or medical technology in particular are just a one and the same term that we are utilizing now in the field of the profession, in the field or in the profession. And I would like to highlight also that formerly, medical laboratory science is known also as the medical technology. And because of the advent and innovation in the field, pinalitan natin yung pangalan. It's already referred to as medical laboratory science. So, medical laboratory science or medical laboratory scientists, when we are pertaining to the individuals who are working already in the healthcare setting, particularly in the laboratory, are known to be able to provide roles in the scenario in the healthcare setting by helping the physicians in identifying the disease by providing laboratory results. But one thing that we have to highlight when we talk of medical laboratory science is that it talks particularly about the branch of medicine that plays a role in processing of specimens, collecting specimens, transporting specimens, and subsequently giving insights to the physician on what are the next things to be done for the treatment of the disease in particular. So, giving or having such a notion on what medical laboratory science is, we would come to know that the role of medical laboratory science then in the healthcare setting is very crucial since physicians in particular depend on us. Naintindihan? So, meaning to say, physicians would be blinded on the next step that they should do to the patient whenever that laboratory results or data are not provided to them. That is the reason why we have medical laboratory scientists who will identify the specimens needed from the patient, who will be processing these specimens, who will be transporting and handling these specimens to the laboratory according to the right procedure or protocol as specified. We are called medical laboratory scientists because we are going to assay, test, or analyze specimens in a systematic way. Systematic in such a sense that any minor problems or derangements perhaps in the procedures we will perform will significantly affect the result of the patient. And as you come to know, any derangements or abnormalities on the result we will provide, it will affect the treatment of the doctor to the patient. And when the treatment is wrong, subsequently, the patient would not really have a good prognosis. The patient might not recover. So it all depends on us. Medical laboratory science is in fact described by scholars as the brain of medicine. Basically because if you would talk of medicine in particular, the healthcare setting would be paralyzed without the medical laboratory scientists or the medical technologists. But medical technologists, on the other hand, would become lame without the physicians. So, if you would see the sequence, you would see the paradigm now. Medical laboratory scientists are important individuals in the healthcare setting, and technically, if you would be immersing yourself in the healthcare scenario, medical laboratory scientists are being confined to a facility. In fact, we are not often seen in the bedsides or anywhere in the hospital. Technically because we have to be confined in a place because our role is very crucial. As I have been able to mention, it cannot be that MedTechs or MedLab scientists will be eliminated in the healthcare setting. Otherwise, the physicians would not be able to help the patients. So, would we be able to be called as a frontliners? Technically, yes. Naintindihan? So, if you would look at the entire paradigm as I am describing, medical laboratory science is very crucial in the diagnostic processes for the patient. And also, we play role not only for the diagnostics, but also our results or our works. The quality of our works would also be the basis of the physician in identifying the success of treatment or the good prognosis or the prognosis in general. It is also a means to identify the recurrence of a disease. So, if I put it in a simple way, medical laboratory scientists then are known to be the helper of physicians by providing insights to them or data to them based on the laboratory results that we give. Okay? So, you might be wondering, what are the laboratory tests being processed? You know, the laboratory tests we process in the hospital setting varies. And the laboratory tests we process are in accordance to the specimens that will be forwarded to us or that will be collected by the medical laboratory scientists. And there are several types of tests depending on the request of the doctor. So, medical laboratory science or the medical laboratory scientists analyze specimens that are not only limited to blood. It is also known that a medical laboratory scientists in particular are known to be able to analyze other body fluids, which may include your synovial fluid, the serous fluid, and even a sweat in particular. At some instance, we also process human waste, such as that of the stool, and there are also sections of the laboratory that we process tissues coming from patients. When we refer to the tissues, we are pertaining to the organs that are removed after surgical procedures in particular. So if you see the entire picture of it or the entire periscopy, we are not just confined on processing blood. So, madami pala ang ginagawa ng isang medical laboratory scientist. We are called scientists now, as I mentioned a while back, because there are also innovations already that has been incorporated in our field. In fact, we are also doing molecular activities or molecular works. In the case of COVID-19, for example, the diagnostic processes are done by medical laboratory scientists. The RT-PCR na naririnig po natin, these are being done or processed by the medical laboratory scientists. The swabbing in particular, these are done by medical laboratory scientists. We are also currently working now on radiologic processes in particular for disease diagnosis. So these are the new trends now in medical laboratory science. So I hope I was able to give insights to our students and also to other viewers who are not part of the MCNP and ISAP community.
So thank you, Sir NJ, for the those information. Sir, tanong lang po namin, Sir, di ba, MedTechs po, they are confined or they are found on laboratories po. And napaka-broad po kasi ng laboratory, Sir. Sir, we would like to know, and for the information of everyone natin, on ano pong mga sections dun po sa laboratories natin, Sir?
Okay. That is a very interesting question. Especially for those who are pursuing to enter the field of medical laboratory science or who are wishing to become medical laboratory scientists. There are several areas in the healthcare setting, or should I say, there are several sections of the laboratory that medical technologists or medical laboratory scientists are working. In fact, the clinical laboratory in particular is divided into two according to the function that it serves. We have what we refer to as your clinical pathology section, and also we have your anatomical pathology section. These are the two general areas. When we are pertaining to the clinical pathology section or the clinical pathology area, it is subdivided into several sections. This can encompass the following. Number one, we have what we refer to as the clinical chemistry section. So, ano tong clinical chemistry section? When we are talking about the clinical chemistry section, well, this pertains to the area of the laboratory or the section of the laboratory that would process or that can entails the processing or the processes of your specimens such as your blood and other body fluids. So, we described kanina kung ano yung mga body fluids. No? Sabi natin, nandyan si cerebrospinal fluid, the fluid that cushions the brain in particular. We also have the pleural fluid, the fluid that cushions or protects the lungs. We also have the pericardial fluid, the fluid that protects or cushions the heart. And there are more. Perhaps if you would join us in the College of Medical Laboratory Science, pag-uusapan natin ang lahat ng yan. But to answer the question or the query in particular, in the clinical chemistry session, what we are testing here are the chemicals that are suspended in the body fluids or the specimens we are collecting. When we talk about the dissolved substances, we are assessing that or we are assaying that in the clinical chemistry section. Take for instance the case of glucose analysis. The fasting blood sugar. Ikaw ba ay diabetic? Kung ganon, kailangan mo ng monitoring. Perhaps, you can do your fasting blood sugar. Naintindihan? Kung ayaw mo mag-fasting, you can have your random blood sugar. Just the same, you can test that in the clinical chemistry section. I-measure natin yung concentration ng glucose mo sa blood. Subsequently, we can also give insights kung ano yung possible na meron sa'yo. But one thing I would like to reiterate and to highlight is that we will just give insights but we do not diagnose the disease. Naintindihan? So, the case for instance of cellular analysis, we do not do that in the clinical chemistry section anymore. Rather, that is done in the hematology section. So, meaning to say, this is the section that would entail the analysis of your blood and the cellular components, which include the red blood cell, the WBC, and also the platelet. In that essence, we are examining these blood cells based on its morphology, based on its functions, and based also on the inclusions that are being incorporated to these cells. The inclusions are more likely related to certain diseases. And any abnormalities on the morphology or the shape or on the appearance would be related to a certain diseases. So these are processed or these tests in particular are done in the hematology section. In addition to that, we also have the coagulation assay that are being done in the hematology section. No? When we talk of coagulation assay, more likely, these are the tests done when you are wanting to know if a certain patient will have bleeding tendencies. Ikaw ba ay may pagkakataon na magkakaroon ng pagdurugo in the future? Then we could be able to anticipate that in hematology section. Or ikaw ba ay may tendency na magkakaroon ng stroke in particular, such as paralysis in the future? Well, we would be able to anticipate that in the hematology section when we do coagulation assay. In addition to that, we also have the clinical chemistry section. In the clinical chemistry section, or the clinical microscopy, should I say, in the clinical microscopy section naman, in this sense, ang ginagawa po natin dito, we have two major specimens that we frequently receive. First, we have here your sputum, particularly when we are testing for the acid-fast bacilli or the causative agent of your Mycobacterium tuberculosis. We can also process urine more frequently when we are analyzing for the status of the body's hydration or possible renal disorders or renal diseases. So, other than that, we can also process stool or fecalysis, ang tawag po kasi namin dito, when we are in the clinical microscopy section. One of the most crucial section in the laboratory that can really help the physician in identifying the treatment of a certain individual is the use of your bacteriology section. Ano po ang meron sa bacteriology section natin? In the bacteriology section, we are doing culture and sensitivity assay. For example, this is just one example. Wherein we are going to identify the existing microorganisms present in the specimen, and by that, we can culture or grow that microorganism, perform biochemical tests, and then we can particularly make use of another procedure to identify the necessary treatment that can be done. These are just examples of the sections of the laboratory. While under your anatomical pathology, we have your histopathological section naman. Sa histopathological section or sa histopathology section, it is in this section of the laboratory where we are processing tissues. So, take for instance, the case of individuals who have been taken out of their tissues or their organs because of particular problems, for example. Dinadala yan sa histopath laboratory for analysis so that we would come to see if there would be tendencies that the person has cancer or the like. And so these are just some examples of the sections we have in the clinical and anatomical. You know, in fact, there are lots of sections that we have now, no? But since we can only describe some of them, I hope enough. When we will be together, mapag-uusapan natin ang lahat.
So thank you Sir NJ for those sections po. Sir, indeed po na hindi lang talaga taga-kuha lang ng dugo or taga-test ng tae or body fluids ang mga MedTech. We are more than that po. Ma'am Marga, ano po yung pinaka-favorite nyo po na section? Pinaka-favorite nyo po na section in the laboratory?
For me, my favorite section would be bacteriology. Yeah. Kasi gustong-gusto ko talagang study yung mga different bacteria. Okay, we're even teaching how to culture, no, in CVMC kasi way back then. So that's my favorite. How about you?
Ako naman ma'am, siguro blood banking po talaga. As in, dun ma'am, we experienced the cross-match ng mga blood units natin, and yung pinaka-enjoy talaga sa internship is yung blood donation. We're going to go to other places to collect blood po, and napaka-enjoy din.
Thank you so much, Sir NJ, for all the important insights about the medical technology.
For the next topic, have you heard about the various myths about the medical technology? If so, allow me to introduce our next guest. Our second guest is currently studying his Masters of Science in Public Health and a graduate of Bachelor in Medical Technology at Cagayan State University, a colleague and currently teaching professional subjects in our own institution. Please give a hand or heart emoticons for our ever dynamic and lively Community Extension Coordinator, Sir Jedrick S. Ramirez, RMT. Sir?
Hello, good morning sa ating lahat, no? Good morning sa ating mga hosts, si Ma'am Marga and Sir Kai. And obviously for the whole ICT department for making this this session possible. Okay, so ang ano natin dito, we're going to discuss about the myths that surrounds the course, the profession. Medyo nakakatawa to, pero this is the truth, whatever, no? Okay, first myth natin, sabi dito, MedTechs are also known as DH or domestic helpers when they work. Okay, sorry, I can help you lang, no? Pero, you know, these are preconceived notions that we should correct, okay? For our profession to be, to stand in our professions. Kasi, syempre, inside the clinical laboratory, we're very unique. No? So, therefore, thereby, hirap nga natin itong mga myths ito. Okay. So, obviously, this is not true. We are not domestic helpers or work abroad. Okay? We work as medical laboratory scientists. Okay? We work inside the clinical laboratory. Okay? We often mingle with other medical professions like nurses, rad techs, and so forth and so on. Okay? So, we medical technologists or we medical laboratory scientists, we perform various laboratory determinations. No? We perform CBC, we perform urinalysis, etc. etc. So, itong myth number 1 natin, i-debunk na natin, no? First myth is, obviously, this is, okay. So, myth number 2, okay, myth na MYTH, hindi myth na karne na MTKT. Okay, myth number 2, MedTechs are doctors inside the hospital. Sana maging totoo, sana all, pero hindi. Okay, MedTechs are not doctors inside the clinical laboratory. Okay, that is a different profession. Remember, when you're going to study medicine, okay, it is under a postgraduate category. Tayo, nasa undergrad muna tayo. So, meaning, this is a pre-medical course, okay, and medicine is postgrad. So, meaning you yet to have yourself enrolled and have a degree, finished a degree in medicine. Okay, so, primarily, why the MedTech is one of the frontliners that is working behind the backs of the physicians, okay, ensuring that the laboratory results are on time, they are accurate, and they are very, very specific. Okay. Myth number 3, MedTechs are repairman, no? The repairman of the laboratory. In other words, they are technicians. No? Pag may silang machina, ayusin. Okay. Well, obviously, hindi lang naman ganun. Okay. One of the many job opportunities that we can have, okay, working as MedTechs would be on the sales representative. So that kind of includes the technical portion of, checking the patient and everything. But, MedTechs primarily work on the processing of different laboratory samples. Okay, this is just but one, but definitely hindi naman tayo yung talagang repairman. O hindi porket sinabing medical technology, o hindi naman tayo yung IT, no? Hindi tayo IT ng laboratory. Well, those skills can be earned. Okay, but then we primarily focus on processing the different samples inside the laboratory. Be it urine, be it blood, pulse, whatever it is. Okay? Okay, myth number 4. Sabi dito, MedTechs are easygoing people inside the laboratory. Sabi ng iba, mga palamig lang daw kami. Okay, hindi naman sa ganon. MedTechs are rather, we are equipped with critical thinking skills that are needed in various skill-based laboratory determinations. So, obviously, when emergency comes, okay, we actually treat our samples as stat, no? Meaning, pag sinabi ng stat, we have a special turnaround time. So, meaning, within the first hour from the time you have received the specimen, dapat matapos, dapat magawa mo, dapat ma-release mo, dapat malaman ng doktor yung resulta mo. Okay? So, ibig sabihin nito, hindi naman kami, well, obviously, kailangan malamig ang laboratory natin. Obviously, kasi nga, okay, we are preserving samples, we are preserving reagents, we also would want to preserve the optimal working temperature of our tests na ginagawa ng mga machines, sa mga principles of machines and everything. So, malamig sa laboratory pero hindi kami palamig lang doon, okay? Okay, myth number 5. Sabi dito, MedTechs are not actually frontliners. Okay, MedTechs are actually not frontliners in the very context of this pandemic, COVID-19 pandemic. Okay, so though the MedTech works behind the scenes of the frontliner pa rin tayo. Frontliner pa rin kami. They are still considered to be medical frontliners along with other paramedical professions like nurses, PTs, pharmacists, ganyan. Okay, in the context of this COVID-19 pandemic, under the molecular laboratory, MedTechs perform screening and confirmatory testings of COVID-19 suspected samples through your real-time PCR. So in short, MedTechs perform these tests, this diagnosis, okay, behind the box. Pero that doesn't mean that we are not frontliners. Okay, we actually, our profession is very crucial. Okay, as it is under the diagnostic part kasi sa laboratory natin, we need evidence-based results or evidence-based diagnosis. So that kind of means pasok dapat sa ano natin. May pasok sa ating principles ng laboratory natin. Okay. Sir, should I go with the one?
So thank you, Sir Jed. But a question for you, no? Do you really think that medical technology is the best pre-med course? Po?
Actually, ano yan eh? This question na MedTechs or the medical technology course is actually the best pre-med course for medicine is actually relative. Kasi back in the day, sinasabi nila pharmacist daw, back in the day, sinasabi nila PT, and then here comes nursing and everything. We should treat every courses equal. Kasi yung mga courses na yan, we have our unique roles inside the hospital, in the healthcare setting. So, we should not treat these other paramedical courses as inferior or kung minsan sabi natin superior. So, medical technology is just but one of the good preparatory medical course in order for you to pursue medicine or should you want to pursue medicine.
Thank you, Sir Jed, for breaking the barriers. No. So for next question,
Break the barriers.
yeah. After finishing the course, what are the opportunities that await you? Okay, the students. What are the opportunities?
Ayan, tayo sa medyo interesting na, hindi naman medyo, no? Interesting talaga na part ng ating Q&A dito sa ano. Okay. So let's discuss about the basic job opportunities of a aspiring medical laboratory scientist or medical technologist. Okay. Start natin dun sa pinaka-una. Well, obviously, the most common one, okay, is you can work as a medical laboratory scientist or in short, clinician or laboratorian ka inside the laboratory. So, ibig sabihin nun, okay, nakasuot ka ng lab gown, nandun ka sa loob ng laboratory, you interact with lots and lots of paramedical professions, including doctors, okay, other consultants. Okay, so we perform various clinical laboratory determinations inside the laboratory. Sabi ko kanina, it from CPC, complete blood count, urinalysis, fecalysis, you name it, the sky's the limit kasi our profession is constantly evolving. So thereby, opportunities would come along the way na mas, in the point na mas nagiging enriched pa, mas dumadami yung opportunities natin. So aside from the very common one, which is you working sa the laboratory, okay, ito naman, this is rather very recent department inside the laboratory, no? We can work as diagnostic molecular scientists. Pag sabi yung molecular diagnostic science for the word molecular, okay, na doon tayo sa department ng molecular laboratory. Okay, one good example, okay, would be, doon tayo yung nagpa-process ng COVID-19 samples. Okay, we perform screening, we perform confirmatory. Okay, so this is a very crucial department as of right now kasi nga, in order for us to help, okay, with the diagnosis of this COVID-19, okay, with these COVID-19 cases, okay, kailangan talaga ng designated na department. And that is for molecular laboratory department. Okay. Another one is you can work as a health researcher or health research scientist, no? Okay. For one, we have a very good example right here. If you know Dr. Luski, he is one of the well-known MedTech researchers, okay, in the region and actually nationwide niya, kilalang pangalan niya. Okay, so if you want to pursue a career in research, okay, if your heart is really in research, if you want to make research your playground, okay, there is definitely a very good opportunity for you waiting in this profession. Okay, next one is diagnostic product specialist. Okay, this is otherwise known as mga medical sales representative natin. Okay, sabi ko kanina, sino ba yung nagsusupply? Okay, who are the well-known suppliers of the reagents inside the laboratory? Sino ba yung nag-introduce ng mga highly sophisticated machines para mag-cater ng ating mga laboratory tests? Okay, these are the sales representative. Okay, so if you are into business, okay, if you want to look at the business side of the profession, okay, so definitely this is a keeper for you. Next one, okay, just like your host and me and Sir NJ, okay, we can also work as professors in the university or college. We can work as academicians. Okay, this is a very rewarding profession kasi nga we are able to establish connections. We're able to establish connections with aspiring students. They become our friends. Okay, they become our colleagues later. And yun lang ang gusto natin eh. We want to make this profession so big, so much, so na every corners, or rather not every corners, so that is just physically impossible, but every region, no? Every region, every barrios, okay, located nationwide, okay, meron tayong medical technologists. Okay? So that is quite important. Okay. So another one, we can work as an analyst. Okay, this analyst pwede siyang analyst, water analyst, soil analyst, and even stone analyst. Actually, itong stone analyst medyo bago to eh. Okay? Narinig ko to sa isang well-known na clinic sa Manila na meron na pala silang stone analyst doon. Okay? So, if you want to see and check if our water supply, okay, is drinkable, is potable, okay, if you want to check the soil before it is actually being bago siya mataniman o pang gagawin with the soil, okay, you can work as analyst. Okay, another one is drug analyst with proper trainings given by proper institutions. Okay, we can actually have a separate certification aside from those 3-letter RMPs. We can be drug analyst, we can be soil analyst, and so on. Okay. So, lastly, you can also be public health practitioners or public health officials. Okay, you can work as public health officers in the RHUs, okay, para ma-reinforce yung ating health protocols, ma-reinforce yung ating tawag na dito, ma-reinforce yung ating best practices when it comes to community and public health. No? Okay, so I think that covers most of the professions or the job opportunities under the MedTech profession. Okay, remember, kung ano yung mga nasabi ko ngayon, hindi lang naman limited dyan. There will be much more coming kasi nga our profession is constantly evolving. It is constantly evolving. Okay. So, nasagot ba yung Sir Kai?
Yes, sir. Yes, sir. Definitely, sir. Sir, thank you, Sir Jed. So, having learned about this job opportunities, guys, mag-enroll na kayo sa MedTech. We are more than what we call na taga-kuha lang ng specimen kanyan. And, syempre, napaka-high din ng rate of employment natin. Especially now that pandemic. Share ko lang, yung batch namin, we are the latest na board passers na ng January 2021 and wala pa kaming 5 months but
Youngest.
then yes ma'am, wala pa kaming 5 months but almost of my batchmates are already employed to these agencies, sir.
To dyan, Sir Kai, no, I can attest to that kasi may mga batchmates kami personally na nasa matagal na sa Middle East,
Yes, sir.
na nakapunta ng US. Okay, some of them are actually working at the US, United States. So pag US, diba, alam mo talaga mataas ang standard when it comes to healthcare. Okay, some in Australia, okay, and actually in every parts of the Middle East. Well, not actually every parts, pero most known parts of the Middle East.
Yes, sir. So, thank you, Sir Jed. Okay,
Thank you, Sir Kai. Thank
yes.
you, Ma'am Marga.
Thank you so much po.
So, before we continue to our next guest, ma'am, let's have a short break muna.
Welcome back, Eagle Squad. Okay, for the next speaker, providing the information as to why aspiring medical technologists need to choose medical colleges of Northern Philippines as their school. Okay, he is a product of our institution, having bachelor's degree in medical technology, and he is currently taking his master's degree in public health at Cagayan State University, please welcome our effective and efficient review coordinator, a proud Mighty Eagle. Let's all welcome Mr. Benedict B. Marquez.
Okay, so hi everyone. Kamusta sa inyong lahat? So I'm Sir Benedict Marquez and you're going to meet me kung magkikita-kita tayo pag nag-enroll kayo for the Bachelor of Science in Economic course. So,
First question po, as a product of this institution, how did MCNP MLS help you achieve what you have right now?
okay, so it's a very, very, very great question, no? Kasi, actually guys, if you're going to ask me, what is your plan, sir, after you graduated high school? Well, I'm going to tell you, actually, I'm not really into medical courses at that time because, you know, ang trip ko noon is history and something na kalinya noon. However, upon meeting our great professors right now, you have already met Sir NJ and Sir Jed. Upon meeting them, no, as well as Dr. Kapili, okay, upon meeting them, nakilala ko pa yung course natin. And they were able to, ito lang yung sagot ko dun sa tanong kasi. Ito lang yung sagot ko. They were able to let me realize what my true calling is. And that is, yun, maging isang medtech. And aside from that, lalong-lalo na si Sir NJ, no? Naalala ko kasi nung nagtuturo yan si Sir NJ, nandun kami sa baba ng campus, pero nadidinig namin siya kahit nagtuturo siya sa upper floors, no? Tapos sinasabi ko sa sarili ko nun, gusto ko maging katulad niya. Yun. So, if you're going to ask me, ma'am, sir, what did MCNP COMS gave me, okay, to help me realize or help me achieve whatever it is that I have achieved as of the moment? Well, they helped me realize my calling. They helped me realize the dream that I really wanted to do. And that is to become a medical laboratory scientist, to deal with the patients, to be an unsung hero behind the curtains of the laboratory and the diagnostic medicine, and as well as to become an academician and to produce an equally competitive and equally worthy na laboratory professionals in the future. So, yes, that's it.
Thank you so much, Sir Ben. So, why choose MCNP ISAP as a school to study this course po?
Wow, you're asking me a very tough question, ma'am. Okay, so MCNP is actually one of the first courses na pumasok agad sa isip ko during that time when there is a campaign drive ng mga colleges ng high school. Kasi very common yun during the face-to-face, diba? Sa high school, biglang may mga pumupunta na mga marketing officials ng iba't ibang universities and schools. Then they are going to market their schools, no, for and the different courses na meron sila. And sa lahat ng schools na nandun, imagine there is andun yung LaSalle, okay, andun yung ISU, okay, meron pang mga coming from different parts of the region. But out of all those schools, ang tumatak lang talaga sa isip ko, ewan kung bakit, ang tumatak lang talaga sa utak ko during that time is MCNP. I don't know why. Okay? Pero, nagsisiba ako, no. Okay? MCNP is a very great institution such that unang-una sa lahat, hindi nangiiwan ng estudyante ang MCNP. We are striving hard, no, to have each and every students na parang dictum ng mga soldiers na we never leave anyone behind. Okay? Number 2, as of the moment, do you know guys, now as of the moment, I was once the laboratory custodian kasi ng MCNP. And one of the many things, no, na nasabi sa akin ni Sir Christian noon is that the laboratory is actually one of the important things na huhubog sa isang estudyante, lalong-lalo na para sa isang medtech na nabubuhay, humihinga sa loob ng laboratory. So, laboratory materials is one of those things. And true enough, kapatid, no? True enough, our laboratory as of the moment is being upgraded and we are seeing a lot more of things, no, coming in no, as a support coming from the department. And you know, baka sa susunod pwede na tayong magtayo ng sarili nating laboratory. Okay? At makakapag-cater ng mga specialized tests. Okay? So, ano pa ba? Aside from the laboratory, we are also blessed with capable, very dynamic sets of faculty members, no, who are really giving their best, okay, despite the challenges of the new normal, no, na talagang sila naman ay ginagawa nila yung kanilang utmost best to help the students, no, to learn and to adapt in the new normal, because according to Ched nga, this is going to be the normal, no? This new normal is going to be the normal thing in the future. So, our faculty members are very effective. They are also very dynamic and very competitive with that particular field. And aside from that, we should also take note that MCNP is one of the emerging powerhouses with regards to the paramedical field in the region. Not only in the region, but of course, no, in the whole country. Okay, we are now one of those powerhouses, such that we are producing turnouts of graduates, no, na hindi lang basta graduates, but they are passers of the licensure examination, top-notchers of the licensure examinations. And aside from that, they are also hired in the hospitals, no, na talagang kilala naman, no, kilalang mga hospitals, St. Luke's, mga ganyan. Now, the mga premier schools of the premier hospitals in the country. So, I think, ma'am, those are the reasons bakit dapat mo, no, kung ikaw ay isang senior high student at ikaw ay nakikinig ngayon, alam mo yon, dapat parang katulad kita, no? Pag kapag naghahanap ka ng mga ng mga schools, iwanan mo ng MCNP kasi yun lang iwanan. Dapat i-leave out mo yung MCNP kasi yan. MCNP is going to really help you to become a successful professional in the future.
Thank you so much, Sir Ben. It is indeed that MCNP is really providing quality education. And in MCNP po, walang iwanan. Okay? So just sit back, relax, and we'll have a short break po. Thank you.
Wake up for a better tomorrow and never allow your past to define you. Open your eyes to countless learning opportunities. Embrace your inner you and conquer your dreams like a mighty eagle. Do not let this pandemic stop you in spreading your wings to soar higher. Inspired by the vision of our founder and father eagle, Dr. Ronald P. Guzman, the International School of Asia and the Pacific High School Department to Gigarao City Campus and Peña Blanca Campus perseveres to provide quality and accessible basic education for all. ISAP High School Department is prepared to cater learners through its learning management system and its well-trained faculty members in the new platform.
Kaya ano pang hinihintay nyo? Tara na! Tara na! Tara na! Tara na! Tara na!
So, what are you waiting for? Anteran! Intayun! Tara! At enjoy ang free tuition fee and miscellaneous fee throughout your senior high school through the voucher program and avail the ESC for junior high school. Join us so together we can say, today the Philippines, tomorrow the world. This is Norway Saludares, proud Isapian, proud Mighty Eagle, mabuhay.
Guest. Okay, the medical colleges of Northern Philippines College of Medical Laboratory Science is not the only pillar in developing and honing student skills. We have also affiliation centers and partner agencies. And to discuss that, we now have our third speaker. She is an alumnus of our own institution and a proud Mighty Eagle. She is also a registered medical technologist and an academician. She's no other than the very own competent internship program coordinator, Miss Arlene Jean Domingo. Mom?
Okay, so first I want to greet all of our viewers for today, a pleasant morning. So when it comes to affiliation centers and partner agencies, we have PAMET, PASMET, and the Philippine Red Cross, these organizations really establish the camaraderie among its members. So may mga programs din tayo like community outreach program, research programs, scholarship programs. And just recently, we have Miss Queenie Miracle Sangap, a level 4 student who received a scholarship under PASMET in partnership with PAMET USA. So for our internship naman, we have hospital affiliations and we are affiliated with Cagayan Valley Medical Center, Mariano Marcos Memorial Hospital and Medical Center, Ilocos Training and Regional Medical Center, East Avenue Medical Center, Bulacan Medical Center, and also James L. Gordon Memorial Hospital. So yung mga sinabi ko na affiliations natin, they really have the best set of globally competent medical technologies. Kasi they enhance our interns' technical and critical thinking skills that are both necessary to become a proficient and effective healthcare professionals, and wherein sooner or later our interns can soon deliver or provide quality healthcare services both locally and internationally. So for our review program naman, we are affiliated with Spearhead. So the team of Spearhead really engage themselves fully in monitoring our reviewees. So they really give their best to help our reviewees in preparing for their board examination. And in-house po ito, they are also the review center na nag-handle kay Miss Tiffany Jane Cabildo, our top 3. And also, a special mention to our review program coordinator, Mr. Benedict Marquez. And thank you, sir, for your passion and dedication sa work nito. So, yun pa yung mga affiliations natin and partner agencies na tumutulong not only for our department but also the faculty and also our students.
So thank you, Mom Arlie. Okay? So education sector is also one of the affected areas in this pandemic. But just like what Sir Ben has told us, our dictum, walang iwanan, make sure that no student is left behind. Okay? So to give us information about how this college prepares us for online classes, let's now also again welcome our program coordinator, Sir NJ Javier.
Sir NJ, what are your academic preparations for online platform?
Okay, first things first, hello again, everyone. Amidst this pandemic or during this flexible learning or distant learning, I would say that the MCNA communities will well equipped for this undertaking that we are currently having right now. In fact, from the very start that we have the pandemic in particular, we have the apprehension that there might be an academic freeze. But technically, we could not stop these processes that we have in helping you and in assisting you to achieve your dreams. That's why, under the leadership of our president, we were able to have a very good preparation for this distant learning. First, we were able to prepare our instructional learning guides, both in lecture and in laboratory subjects. In fact, across all year level in particular. And in addition to that, the institution has also been able to subscribe to the learning management system using the Moodle Cloud. And this is in success now for its full implementation starting last semester. In fact, we are also utilizing Zoom for the consultation to the students. So these are the academic interventions and preparations that we have been doing these previous months in particular. And in fact, we are adopting it already and utilizing it successfully these previous days. In addition to that, we also have been able to communicate still to other institutions such that in case of your hospitals, which is kailangan kasi natin sila for the internship program. So, some people might be thinking, kung magme-medtech ako, baka mamaya hindi pa matatapos yung pandemic, baka hindi ako magiging intern. That would be the common presumption, Ma'am Marga, no? So, I am happy to inform you that we were able to resolve that concern. We can proceed with internship, but we can do it on a virtual mode as of this moment. And in addition to that, I would also like to highlight that we would be able to continue on having the student support as part of the preparations this pandemic. In fact, we can still have the mental health webinars and orientations to our students and also to the faculty members also. Likewise, we can also pursue or continue on the spiritual activities or spiritual sessions that we have, but all of these are done through virtual. So, more likely, I could say the school or the institution has been able to equip itself in doing its best in the delivery of the academic or quality education amidst this pandemic. In fact, just recently, because of despite the challenges that we have, we could say that the preparations that we were able to have are somehow successful, or should we say it's really successful. Indeed, it also served as an inspiration to each and every one of us. In fact, if you would look, for instance, in the previous months, we were able to have a very good licensure exam result in the College of Medical Laboratory Science. And by the way, I would like to greet the College of Radiologic Technology for having been able to produce new registered radiologic technologies from the College of Medical Colleges of Northern Philippines. And inasmuch, I would also like to congratulate on behalf of the MCNP and ISAP community, the ISAP Kalinga, for having been able to produce top 1 in Associate in Radiologic Technology. So these are our inspiration to prepare some more amidst this pandemic. We should not stop in providing the best for the students. This is what quality education is, and this is also the insight and the vision of the founder of the institution, Sir Dr. Ronnie Guzman.
So to end it formally, sir, what is your message to aspiring students who want to pursue this relevant profession?
Okay, thank you so much, Ma'am Morga and Sir Kyran, for that. If I would say, message for these students who would be able to pursue medical laboratory science, siguro I would like to put it this way. The country as of this moment is needing lots of healthcare provider. So I know that many of you would like to help each other and to serve the community in particular in battling this pandemic. In fact, becoming a medical technologist or becoming a medical laboratory scientist is our way of helping the healthcare sector in providing the needs of the community. So, Ma'am Marga, perhaps if we will be having enrollees who will be pursuing medical laboratory science, and our students who are currently having their education in medical laboratory science, these are the future unsung heroes. Unsung heroes because technically, we are not really visible to the community when we are doing our job. But still, I pray that we should keep steadfast on our goal. We should remain humble in our purpose, and we shall work silently. It is the product or the end of our work that will speak for itself. And aside from this, I would also like to remind everyone to please stay safe still amidst this pandemic. We are not done yet with this battle. And obviously, I would like to thank you for your faithfulness to our institution and also for being able to establish your rapport and your trust to each of us. Malaking bagay yun para sa amin. In fact, I would say, minsan nakakapagod yung mga nangyayari sa ngayon, but because of our students, but because of the friendship that we have amidst all of this hardship, we can say we can keep on going. And I would also like to invite those K-12 students who are listening to us, perhaps, or should I say, it is still, it is a good idea to be part of the MCNP community, College of Medical Laboratory Science. Samahan nyo kami sa journey ninyo sa College of Medical Laboratory Science or sa journey ninyo sa college or sa tertiary education. And we can say or we can conclude that it will become a fruitful journey. Sabi nga ni Sir Benedict kanina, if he would only be able to choose again, then he will always choose MCNP College of Medical Technology because he has a very good experience in the institution. And I know that if you will be joining us and will keep on joining us, you will be having the same. At some point, there might be hardships, but that will make you a better medical technologist. That will make you a perfect or a medical laboratory scientist. All of these are part of the process. Just trust the process. Just keep your faith burning. Kapag kasama ka namin dito, wala kang talo.
Thank you so much, Sir NJ. Indeed, today, we have come to realize the importance of medical technology profession, especially during this pandemic.
Medical technologists are the silent heroes of this time. We are the hope of tomorrow. Be one of us. It's a good day to be alive.
We're signing off.
Welcome to the College of Medical Laboratory Science of the Medical Colleges of Northern Philippines, where we nurture the young minds of the trusted and future medical laboratory scientists of the country. Spread itself with a roster of highly competent faculty members from the region's best lecturers and skillful clinical instructors. Our laboratory is well equipped with laboratory instruments, making it a great place for students to enhance their learning by understanding the theoretical concepts and will supplement all the lecture components of each subject. various outreach and development programs for the upliftment of health of the adopted community. The fourth-year internship program is an opportunity for MLS students to be exposed in a real healthcare setting where they can have a practical training in an accredited and prestigious hospitals in the country. The college also holds institutional review to prepare students in the licensure examination. Practices make the college to be competitive in the licensure examinations. In fact, the college sees 100% passing rate on its pioneer batch. With the college's consistency, it managed to maintain its passing rate until recently this year. Ms. Tiffany Jane Cabildo landed top 3 in the January 2021 Medical Technology Licensure Examination. These are just sneak peeks of what what our college has to offer. If you want more, join us and be one of us.
Bachelor of Science in Medical Laboratory Science is a four-year degree program that equips students with knowledge and skills in laboratory tests used in the detection, diagnosis, prevention, and treatment of diseases. Students will also learn how to use modern equipment, instruments, and scientific methods to provide accurate laboratory results.
Have you ever wondered how physicians identify diseases to patients? Have you ever wondered how doctors cure diseases? Dear Mighty Eagles, in the next few days, in the College of Medical Technology, College of Medical Laboratory Science, we will unveil the mystery of disease diagnosis. Sa MLS, pag-uusapan natin yan. We are so elated to meet you later on. My fellow colleagues, your clinical instructors have been long awaiting for you to see us and for us to share our expertise and knowledge to you. Welcome to this fiscal year 2020-2021. Together as one family, together under our department, we will make a history. Be with us and we will change the history of COMT and CNP as we will become great healthcare professionals here in the country and in the world. My dear students, we will be very willing to see you soon. In 3 days' time, we will make another history. Once again, welcome, dear Mighty Eagles.